Dandridge,
You gotta go.
and I present to you my family. We are all sickle cell warriors. And we just want to give you, an idea of what sickle cell is and how it impacts our family. So first we want to start off, where did sickle cell start? The first case of sickle cell disease in the United States was described in 1904 when Walter Clement Noel, a 20-year-old dental student from Granada, sought care for anemia in Chicago Presbyterian Hospital, where he met Dr. James B. Herrick, a cardiologist and professor of medicine. Noel experienced recurrent episodes of muscular rhetorism and violacious attacks over a period of 3 years. Dr. Herrick assigned this case to his intern, Dr. Ernest M. Irons, who performed the initial blood work of Noel. He observed the unusual sickle-shaped red blood cells in simple under the microscope, and informed his attending physician about the odd-shaped cells. Dr. Herrick then took an interest in the case, given the unknown nature of the novel disease. In 1910, he published the first documented case of sickle cell disease titled Peculiar, Elongated, and Sickle-Shaped Red Blood Capsules in a Case of Severe Anemia in the Archives of Internal Medicine. This disease, named sickle cell anemia, was not coined until 1922 by Vernon Mason. So, recorded history in Africa. Although Herrick described the first known case in the United States, sickle cell disease, sickle cell disease has existed for generations and families in Africa and Mediterranean descent. It was described in local African medical literature around the 1870s and the phrase Obanges, which translates into children who come and go, due to the high mortality case and rate of infants with this disease. Let me say that once again. The name Obanges, which translates to children who come and go, due to the high mortality rate of infants with this disease. One Ghanaian family traced the inherited disease back to 1670. So sickle cell disease was actually traced back to 1670. So what is sickle cell disease? Sickle cell disease is a disorder that affects the red blood cells caused by one mutation. It is the most common genetic disorder diagnosed worldwide. The patient's red blood cells are a crescent moon shape instead of normal red discs. So as you can see on my shirt, this is a normal blood cell. This right here is a sickle cell. The patient's red blood cells are crescent moon shape instead of normal disc shape, and they are also flexible, which can cause blockages through the blood vessels, resulting in episodes of pain. Patients have weaker immune systems, and the disease can affect other organs such as the heart, the lungs, the kidneys, and the liver. Some patients are at high risk of infections, strokes, pneumonia, meningitis, and bone infections. There are several types of sickle cell diseases. The most common is sickle cell anemia, which is also translated as sickle cell SS. Sickle cell hemoglobin SC, which is not as high as sickle cell SS, but don't get it twisted. We still go into sickle cell crisis and go into a lot of pain. And myself, my daughter, and both my sons suffer from sickle cell SC. So I'm going to also talk about the sickle cell trait, which my wife has. The sickle cell trait, also known as SCT, is not the disease, but having it means that a person has inherited the sickle cell gene from one of his or her parents. People with SCT usually do not have any symptoms of the sickle cell disease and can typically live a normal life. So what are the facts and myths of sickle cell disease? Here's a fact. Sickle cell disease is not contagious. So if I touch you, you're not going to get sickle cell. If I was to kiss my wife, she's not going to get sickle cell. It is a genetic blood disorder that a person is born with. Blood flows everywhere, so a sickle cell crisis can occur anywhere in the body. Another fact, sickle cell disease is a medical emergency, just like a stroke or a heart attack. People with sickle cell disease are not lazy. People with sickle cell disease are not lazy. They are just easily fatigued. Now here's a myth. African Americans are the only culture that suffer from sickle cell disease. That is not true. A lot of people think that. Sickle cell disease affects many other cultures. And also with, a lot of people intermarrying with different nationalities, different races. Of course, the genes can mutate and cause another person of another race to have sickle cell disease. So that is a myth. If anyone ever tells you that sickle cell disease only affects black people, that is a myth. Sickle cell disease affects millions of people throughout the world and is particularly common among those with ancestors that came from sub-Saharan Africa, Spanish-speaking regions in the Western Hemisphere, such as South America, the Caribbean, and Central America, Saudi Arabia, India, and the Mediterranean countries such as Turkey, Greece, and Italy. So impacts of sickle cell disease to myself and my family. Sickle cell disease is not one size fits all. My experiences with sickle cell disease may be different than what other warriors experience. Again, our family motto is sickle cell disease is not one size fits all. And we say this because it is true. Throughout my 39 years, I have personally experienced multiple sickle cell pain crises in my back, in my legs, in my arms, and in my chest. I've experienced memory loss. I've experienced the need to have multiple blood transfusions because my body rejected the blood that was given to me during other transfusions. I've experienced having multiple strokes back to back, all because of the major sickle cell crisis that I had in 2014. This along with having multiple systems within my body shutting down. I was forced to rely on a wheelchair for 2.5 years for mobility because I could not walk due to the strokes. And this was And to this day, I still rely on an electric scooter to get around, like if I'm going to the supermarket or to the mall or something, because I can't walk for long distances. Sickle cell is not one size fits all, because every warrior does not experience some of the things that I have discussed. And there are things that I have not discussed, there are things that I have not discussed, or that I have not experienced, that other warriors are experiencing or have experienced. Another thing that I have experienced myself in the care for my daughter is when doctors and even nurses say that they know what sickle cell disease is. They attempt to treat sickle cell disease based on what they've read in a textbook. This is unsafe and it's unfair. You cannot assume, they assume that sickle cell patients are drug-seeking individuals. When we go to the emergency room, and in most cases, that is not the case. Yes, some of the narcotics work. However, it does not. However, if you do not know the pain of a sickle cell crisis, you should not make those assumptions. When I worked for BGE, we always said to stay prepared for power outages. And Brittany, you know what I'm talking about. A power outage could happen in the event of a storm, or even on a day like today, which we considered a blue sky day. We could have a power outage. Blue sky days, I associate that with sickle cell disease. Because again, a day like today, where it's perfectly fine outside, one of us can go into a crisis. It can put you in the hospital for weeks, days, and sometimes months. There's warriors who's actually spent months in the hospital because they're going through a sickle cell crisis. Johns Hopkins is like our second home. We have been deemed one of few families that have several members in the immediate family who suffer from sickle cell disease. With my situation that occurred back in 2014, they have added my situation to their curriculum for when they're teaching new doctoral students. Pass it on to my daughter.
Dandridge. I will be talking about my experiences with sickle cell. In May, 1 week before my birthday on a Sunday night, I started feeling pain in my chest. I thought that I was just having indigestion, but later into the night, I ended up feeling pain in my arm as well. I woke up to get ready for school, and I felt my other arm go weak. I ended up going to the hospital. I was in the ER all day. I got admitted that night, and the whole time I was in the sickle cell crisis. After being provided with medicine around the clock, it still felt like the pain was not going away. It was just there at the same pain level. The pain ended up moving to my back, so now my back, both arms, and my chest were hurting. I was hooked up to the IV that I was able to control, and it would give me a self-prompted dose of medicine every 10 minutes. On Saturday, I was discharged because the pain was not going anywhere, and there was nothing that the doctors and nurses could do anymore. I went home with the continuous pain and was taking antibiotics. The pain lasted all the way to Wednesday that following week, and my birthday was on Friday. On Monday, I had to leave school early because I was having pain. I'm here to say that you could be doing absolutely nothing and end up in a crisis.
Hi, my name is David Dandridge. III. My experience with sickle cell has not been as extreme like my father or sister, but I do have some symptoms. I have been hospitalized because I had an acute chest. An acute chest syndrome is caused by fevers and respiratory systems like pneumonia. This is an acute compilation of sickle cell disease that is potentially fatal and requires immediate intervention regardless of the patient's age. I experience yellow in my eyes. Sickle cell causes a person's red blood cells to die quickly in a normal person who doesn't have sickle cell, which the yellow in the eyes. This is called jaundice. Jaundice is common for a sickle cell patient. This is how sickle cell affects my life.
Hi, my name is Dandridge. When I was 4 months old, I was very sick with having fevers. This was a sickle cell crisis, and I had to stay in the hospital for 1 week. As I was getting older, I have pain in my leg. After I run around or play too long.
So maintaining as a family, in order to keep our family's health and well-being, we are a family that prays. Try to stay hydrated, eat right, take our medicines and vitamins. Most importantly, we have to take time to rest and relax often. Oftentimes lack of sleep can trigger things like crisis. Stress is the #1 trigger for most diseases, and we have to watch what we are doing both mentally and physically. To whom much is given, much is required. We are a praying family. We recognize that no man can take credit for what we do, how we live, maintain our lives. Furthermore, we know that it is only by God's grace that He has His hand over our lives. One of our favorite scriptures is, I can do all things through Christ that strengthens me. Thank God that we have a church family who prayed for us during hard times and continues to pray for us and support our lives. Some of the work that we have been doing is, David is on 2 boards. He's on the board for Project Spirit Sickle Cell. He's the vice chair. Provides spiritual counseling for young adults to explore personal beliefs and navigate medical and life's transitions as well as challenges of living with sickle cell. He's a board member and technical advisor for sickle cell disease through Maryland Sickle Cell Disease Association as well. And earlier this year, I took on a training and became certified as a community healthcare worker through the National Organization of Sickle Cell Disease Association of America. And I was selected to work as a transition navigator for adolescents transitioning to adult medicine. What you can do to help support those with sickle cell is understand the signs sickle cell warriors are having when in a crisis. Having a fever above 101, difficulty breathing, chest pain, abdominal swelling, severe headaches, seizures, sudden weakness or loss of feeling and movement, and also a painful erection that lasts for more than 4 hours. Donating blood through American Cross, specifically asking to donate blood under the blue tag donation, which is for sickle cell warriors. Donating also to certified sickle cell organizations such as Sickle Cell Disease Association of America and Maryland Sickle Cell Disease Association. And there's a chapter that we support out of Atlanta called My 3 Sicklers. Thank you everybody for hearing my presentation.